Hello, everyone. Thank you so much for taking your time to tune into our webinar today. I hope you have had time for dinner. My name is Fatin Zafira, your caring pharmacist and host for today. So, have you heard of osteoarthritis? I am sure you might have heard it from your family members, friends, or you might even be experiencing it yourself. So, our topic today revolves around the efficacy of glucosamine formulation in treating osteoarthritis. Before we start, let's just do a quick poll with our audience. How many of you are consuming glucosamine? So vote your answer in the poll. Okay, I'm seeing people are answering more now. Okay. Oh, there are actually quite a number of people that are consuming glucosamine supplements. But the majority of you are not consuming glucosamine supplements. Okay. All right. So about 59% of our participants tonight are not consuming glucosamine supplements. So I'm sure either you answer yes or no. I'm sure you're also wondering, what does glucosamine do? How can it help with osteoarthritis? So today we are going to be answering all these questions. And if you do have any questions regarding glucosamine or even osteoarthritis, just leave your questions in the chat box because we will have our expert today to answer you. All right. So our expert today is a consultant orthopedic surgeon from the Orthopaedic Specialist Centre who has extensive research and working experience in this field. And don't forget that we will have a surprise giveaway in between the session. So make sure you stay tuned and pay attention to the doctor's slides until the end. Without further ado, let us welcome our guest of the day, Associate Professor Dr. Tai Cheh Chin. Hi, Doctor.
Hello, hi.
Hi, Doctor. How are you? How was your day?
Good. I'm very good. Thank you. Thank you very much. Thanks for having me this evening to talk about my favorite subject, which is glucosamines in osteoarthritis.
I'm sure you do look excited to share on this topic.
Yes.
All right, Doctor, before we get into our topic today, I think some of the audiences today here, including myself, are curious on what does a consultant orthopedic surgeon do on an everyday basis. So maybe do you mind sharing your day-to-day tasks?
It's actually pretty boring. My day start at about 7 o'clock in the morning. Normally, I'm in the hospital at 7. My job consists of 3 parts. I'm a surgeon, so the major part of my job is operating in theater. I'm a hip and knee specialist, so I do a lot of hip and knee replacements or other surgery. So the other part is obviously in the clinic seeing patients, and the last part of my job is doing a ward round. But there is more a clinical part. I'm also quite interested in educations. I do travel quite extensively. If not because it's COVID, every other month I'll be in other countries doing some workshop, giving some lectures, sharing my experience with other surgeons. I just came back from Korea actually. I was there for about a week. So we did some robotic surgery, and also I did give a couple of lectures to some of the orthopedic surgeons over there, and we do some academic exchange. Generally, you know, as a doctor, we have to keep on learning. So apart from working, we also have to learning from each other. So that's pretty much my job. I have fairly busy practice. I work about 16 to 16 hours a day on average, about 5.5 days. Saturday is my half day, which means that I finish at 5 p.m. so that I can have dinner at 6 or 7 o'clock. That's the only day I have a normal dinner, and Sunday, obviously. Other days, I normally have dinner around 11 o'clock.
Wow, doctor. Here I am complaining working 12 hours and you're working 16 hours per day. But your day-to-day task doesn't sound boring at all. So in short, you're actually helping people to walk again and you travel a lot, which sounds a lot more fun. All right, doctor, before we proceed with our discussion, be sure, I just want to remind our participants to stay with us until the end of this webinar, because we will be having a giveaway for 3 lucky winners for a bone mass density test voucher worth 150 ringgit each. And to all my lovely caring members, if you have the caring membership, you're in luck, because if you stay until the end of this webinar, 500 caring points will be credited to your caring mobile app after the session. All right, doctor, let's get into it. Our topic today is, does all glucosamine formulations have the same efficacy in treating osteoarthritis? To start us off, I would like to ask Dr. Tai this very important question, especially for our audience who are eager to win our special giveaway. What is glucosamine actually, and what are the formulations available in the market?
Sure. Well, let me start sharing, if I may, sharing my screen. Let me see whether I can get this right. Can you see my screen now?
Yes, doctor.
Yes.
Then you have to press play and share your screen.
Yeah. Okay. Is it right?
Yep.
Okay, right. Okay, good. Okay. So glucosamine is actually a building block for the cartilage of the joints. Our joints is made up of bones and the cartilage. Cartilage is the end of the bones, which I will explain a bit later at the later slide. So the glucosamine is a very important building block of the cartilage. If you can look at this, a slightly more biomedical pathway. It's a bit complicated, but basically you can actually absorb glucosamine through our body, through external or internal source, and we'll go through the pathway. I think interesting here at the pathway is that if you look a bit closely, before it formed the cartilage, it actually also become a chondroitin sulfate, which is another supplement, which is very commonly mentioned about helping osteoarthritis. So both glucosamines and chondroitin sulfate is the building block for our very important cartilage, which is part of the very important part of our joints, especially the knee joint. So the always question asking to me actually is that, are all the glucosamine are the same? You know, are all of them the same type of thing? You can see there are many different type of glucosamines in the market. I'm not sure how many Caring has on itself, but the last time we calculated, there are more than 50 to about 60 different type of glucosamines. So the big question always asked is that, are all the glucosamines are the same, right? So if you look at the glucosamine components, there are 3 different type of formulations in the market today. There's a crystalline glucosamine sulfate, which is the one that we always recommend to use. But there are other type of glucosamines. For example, there are glucosamine sulfate, not the crystalline type, another glucosamine sulfate, or more commonly, there's another type known as glucosamine hydrochloride. Now, the 3 different type of glucosamines is widely available in the market. And if you pick up the bottle, you will see they are either glucosamine sulfate, they are either glucosamine hydrochloride, or they are crystalline glucosamine, what we call as a CGS. Now, all the glucosamines are different in terms of 2 things. In terms of penetrations, which is very important. If you take something, it doesn't penetrate into our body, or it doesn't get absorbed, or it doesn't get into the joint, which we want it to be, then it's pretty useless, right? So when we look at the glucosamine, we must understand, does it go to the joint where we want it to be? And number 2 is that, does it stay there, right? In the therapeutic level. We don't want it to go there, but it doesn't reach the therapeutic levels, right? Then it's of no use as well. So if you look at the 3 different types of glucosamine that we have, and there's, unfortunately, or fortunately, there's only one type that can penetrate into the joint at the level that's sufficient to be therapeutic. And that one is what we call a crystalline glucosamine sulfate. So So you might ask me, well, so which one is that? Unfortunately, as a doctor, I cannot tell you the brand. So I can give this slide, tell you there's only one brand that actually have this. And this is the one that showing on the slide now. Okay.
Okay. All right, doctor, before we proceed, maybe you can adjust your slide size.
Okay.
It's a little bit small.
Is it better?
Yes, that's a lot better. Thank you, doctor.
Okay.
Okay, now that we have covered a little about glucosamine, doctor, maybe you can enlighten us on what osteoarthritis is and what are the major symptoms of people suffering from osteoarthritis?
Okay. Osteoarthritis basically essentially is a wear and tear of the joint. You see, for example, if you pick my favorite joint, which is a knee joint. The knee joint make up of 3 bones. And if I can show you here, there's a thigh bone, shin bone, and the kneecap. We call it the patella. All the joint is lined by a layer of white tissue, which you see on the screen. That tissue is known as cartilage. Now, cartilage, if you can see now closely, is very smooth. It's very nice, right? But after a while, cartilage will go through wear and tear. So the wear and tear of the cartilage will happen to everyone. Will happen to me, will happen to Miss Fatin, will happen to all of you, right? And the wear and tear of the cartilage is what is called osteoarthritis. So osteoarthritis is a Latin word, which means the inflammation of the joint due to wear and tear. So that is exactly what osteoarthritis is. Now, as I said, this happened to everyone. That's why I'm busy. That's why I see my patient until midnight, right? All of us, whoever have joint will end up with osteoarthritis. Now, the symptom of osteoarthritis in the early stage normally is pain, especially when you're getting up from sitting position. Sometimes when you're going up and down stairs, you feel a bit of stiffness, feel a bit of discomfort or a bit of noise, right? These are all early signs of osteoarthritis. However, when osteoarthritis becomes more and more advanced, then you start to see some visible changes, physical changes on your knee. For example, you get what we call an O-shaped knee, right? Which I'll show you in one of the patients. The shape, the knee make up like an O. So that deformity, and then people find it more and more difficult to walk. And you start to have pain when you get up and you try to walk, and the pain getting worse and worse. And you get morning stiffness, you get a swelling of the knee, right? And sometimes you can even have bone spur growing around the knee joint, which become very, very painful. So these are the signs and symptoms of osteoarthritis. And it can affect any part of the joint. The most common obviously is the knee or the hip, but it also can affect the spines and other part of the joint as well.
Okay, all right, doctor. I noticed that earlier you did mention the word osteoarthritis getting more advanced. So what are actually the stages of osteoarthritis and how common it is? And also, why is it so important to treat osteoarthritis?
Right, okay. Now, osteoarthritis can divide into 4 stages, but generally you can divide into the early, moderate, or late stages, right? And you can see that when at the early stages, you can treat with some medical treatments, but when it comes to more advanced stages, then it's a bit more difficult. I always tell patients in a way they can understand. It's like, the tire, after you drive the car for a while, it gradually becomes botak, right? So at the early stage, you can maintain it by looking after your tire, how you change the way that you drive, and how do you look after it, right? Avoid certain roads so that your tire lasts longer. But as it goes longer and longer, when the tire becomes complete botak, then unfortunately you have to change your tire. That's where you have to do a knee replacement. So the progressions of the osteoarthritis divide into stage 1 or grade 1, grade 2, grade 3, and grade 4. When it comes to the late stages, there's absolutely no cartilage between the bones. There is bone on bone, as you can see on the right side of the grade 4 of the screen, where the bone is touching each other. So there's the most advanced stages of osteoarthritis. So why is it important? It is a major problem, right? Every day, just in America alone, there are 100,000 people seeking some kind of medical treatments for osteoarthritis. And this is only in America alone, 100,000, all right? And this is interesting. This is an article published in 1998 by Lawrence, and they estimate that osteoarthritis is going to affect the majority of the people, and in 2020, it's going to affect 60 million people. So in 1998, when we look at this number, it's like, oh my goodness, this is going to be a big problem for the world, right? 60 million people in the world is going to be affected by osteoarthritis. Do you know? We couldn't be more wrong. Do you know
Wow.
how many, but you know, by the time they're 20, do you know how many people affected by osteoarthritis? It's not 60 million, it's 500 million.
Wow.
Okay, so 500 million people in the world, and I'm sure any one of you, in fact, you know, you can see the screen of the Indian lady that walking, and that's what I mean by the O-shaped knee, right? You know, one of my favorite pastime, if I do have time on Sunday, I go to Mid Valley. Well, I don't go there shopping, I look at people's knee, and you'll be amazed how many people's knee walking exactly like that, right? So it's a very prevalent. So how prevalent it is? If you this another study that look at you know, people who have no symptom. So this is a study carried out in Canada. They look at people generally are quite young. These people are aged 35 years and above. And they found that about a quarter of them actually already have early signs and symptoms of a knee without them knowing. When they do the x-ray, they already saw. So it's very, very common. And these are very, very young people. In fact, we have called the last decade as the coming epidemics of arthritis. So the question is that why is it become more and more common? Well, there are a few reasons, right? The first thing is because they are more and more human, right? So this is a very common, this is a wear and tear. When there are more cars in the road, more tire become bought up. When there are more of us, the number of people getting osteoarthritis is getting more and more common. So if you look at, you know, we are hitting almost 10 billion people. So that's why the people who getting osteoarthritis is more and more. But this is not the only reasons. The other important reason, because we are living longer and longer, all right? So if you look at this map, okay, by 2040, okay, almost every part of the world, we have an elderly population. So the elderly population definition is people who are aged 65 years and above, right? Now, at the moment in Malaysia, for example, about 7% of the populations in Malaysia age over 65 years. And so we are quite a younger population as compared to Japan now. About 30% of the population in Japan are elderly populations. So it's a lot compared to, we are younger by 7%. But by 2030, the number is going up to 15%. Right? It's almost double, right, in 8 years' time. So in fact, if you look at the whole map, by 2040, most of the part of the world, except Africa, every part of the world are considered the elderly population. That means more than 15 to 20% of their populations are made up of elderly. And it's a major problem. So when we see osteoarthritis are more common in people who are older. So that's why it becomes more and more common. Well, this is not the only reason as well. Other important reason is because, for example, we are gaining weight, right? Malaysia is famous to be one of the most heavyweight populations in Asia. So putting more and more weight also wear and tear the knee joint faster. So that is also a concern. Other problem, because we are getting more and more active. And also we have this new generation, people are more intolerant of pain. Last time, you know, I remember my grandmother's walk with a very crooked knee. He said, ini sakit orang tua biasa, you know. But nowadays, when I come to my father and mother, you know, they don't tolerate pain. They say that I want to be able to travel, I want to enjoy good life. I don't like to have pain. So that's why more and more people are seeking treatment for osteoarthritis. And it has become a major epidemic of the world. And this is one of the most disabled diseases in the world currently affecting all of us.
Okay, I totally agree with you, Doctor. Even in the pharmacy, I do every day on a daily basis. I keep getting people coming in with a prescription for glucosamine, or even just coming in to us for supplements or medications to help with their knee pain. All right. Before we proceed, I just want to highlight to our participants, if you do have any questions for Dr. Tai, you can just put it in the chat box and Doctor will address it later on. All right, Doctor. Now that we know we have a better understanding on glucosamine, maybe Doctor can explain a little bit more on the scientific evidence about crystalline glucosamine sulfate in treating osteoarthritis and how it can help.
Okay, sure. Right. So the evidence is quite overwhelming. I mean, there are many supplements. I'm sure that, you know, like Fatin, that you said, people always ask you which one will help osteoarthritis, right? So yep. It's not easy to know which one works better, because there aren't that many studies evident to compare supplement to supplement. But one that stands out very obviously above all other supplements is this crystalline glucosamine sulfate, which is a CGS, right? Now, a lot of studies over the year has shown that it does three things, this crystalline glucosamine sulfate. Not only it relieves the pain, it actually improves the physical functions. And in people who take it for long term, they mean more than 2 or 3 years, it actually make the joint space a bit wider than it was before. So these are the evidence which is very, very strong. So, I'm not going to bore all of you with all this scientific evidence, but this is one of the studies, for example, they compare to a lot of other supplements. And the glucosamine, the crystalline glucosamine sulfate, the one that is mentioned here, is the only one that showed it actually improved the pain and the physical function in long term, all right? And this another study showed that if you put glucosamine, take glucosamine long term over the 3 years period, actually you can not only improve the pain and the physical function, even on the X-ray, there's an improvement of the joint pain, which means that there's some hope that you might not need to come and see me and do a knee replacement. All right, so there is a hope on this paper. And then there are other papers as well showing that long-term glucosamines actually will improve the disease of osteoarthritis. And I think the evidence from all this in terms of pain, in terms of physical function, in terms of to delay the need of operation is very, very convincing based on all these studies that we have. And this study have been carried on for a long while. It's not just recently, but it has published over the time. So it's not just one institute, it's not one country, but from different countries of the world. So we like evidence like that where, it's not just one, because we always worry something called bias, right? If it's somebody, maybe paid by the company and doing some research, the research is more favorable. But when these results are coming from different institutions over the world and then over a period of time, so this evidence becomes very convincing. So I'm a clinical evidence-based doctor. So everything that I do in my practice, I must be able to explain to my patient because of the research result, because of the experiments, and because of the clinical study. And this is what I base it on.
Yes, Doctor, I completely agree with you. And as you mentioned in the earlier part of the webinar, if you go to the pharmacy, there are 50 over products that contain glucosamine. So this is when you actually look into the ingredients list and look for crystalline glucosamine sulfate instead of just any other form of glucosamine salts. All right, Doctor. Now that we know how CGS can help in the different stages of osteoarthritis, how long should we take CGS for our osteoarthritis until we are able to see the improvement with CGS?
Right, okay. So glucosamine sulfate doesn't work instantly. It's not like a painkiller. If you take a painkiller, instantly you'll feel that, oh, I got pain relief after a few hours. So that is a good thing about the painkiller. But then we know that painkiller is not a good long-term treatment, because painkiller, even paracetamol, has side effect to the liver, to the kidney. So whereas supplement like this, it is better because it has a less side effect. However, as I say, it does take a while. So average, we say about 2 to 3 weeks, and sometimes we see the effect after probably about 3 to 6 weeks. So generally you have to be a bit patient, because this is a long-term treatment and you have to take it for a while before it becomes evidently that it's going to help you. So you have to be a bit patient with that.
All right. I think this is the misconception that we really need to highlight and address, because a lot of, even in the pharmacy, a lot of my patients are assuming that if they consume glucosamine sulfate for maybe 1 to 2 days, they are able to see the improvement already. So just please remember to consume it consistently for us to be able to see the results. All right. Now that we know crystalline glucosamine sulfate has so many benefits and it only takes 2 to 3 weeks time to work, Doctor, what is the dosage like, and when is the right time for us to take crystalline glucosamine sulfate? Before meal or after meal?
Well, because it's a supplement, and the beauty about this, actually, it doesn't irritate the stomach that much. So you can actually take it anytime that you want. Okay, I mean, the dosage that is recommended is a 3 capsule. You can take it 1 capsule 3 times a day, or generally I tell my patient to make it easy, just take it 3 capsules once a day, because the half-life of the glucosamine is almost 24 hours. So you actually can take it 3 capsules in one go once a day, or you can take it one session. It doesn't really matter that much whether you take it before meals or after meals, or you can take it anytime. But my favorite prescription, I always take it at the regular time. So if you take it first thing in the morning, before breakfast, when you put it, let's say, because people always forget, so I say put it in your bathroom when you brush your teeth, just after you brush it, just have a sachet. Or if you have it after breakfast, that is fine. Or you have it before you go to bed, that is fine as well. But just try to take it consistently at the same time of the day. But it can be taken anytime. It doesn't matter before meal, after meal. If you really worry, you can take it after meal. But it really doesn't irritate the stomach that much, not like some of the painkiller. So that's the good thing about glucosamine. You can take it anytime, just once a day.
Okay. All right, Doctor. You did mention earlier that osteoarthritis affects more of the elderly group who might also have other comorbidities like diabetes. So maybe you can share whether CGS affect our blood glucose levels.
That's right. You see, the glucosamine. So the word glucose actually is already suggests that it has a glucose component. And so I often get asked, does it affect my blood pressure? Does it affect my kidney? Does it affect my diabetes? Well, it doesn't actually. I mean, the content of the glucose is very, very low. It's almost like drinking less than a can of Diet Coke, or people say less than 3 grapes a day, right? And it doesn't affect diabetes. I got a lot of patients. So far I never stopped somebody from taking glucosamine because of raised glucose. And it's not only just my experience. I mean, this is the paper that have been published. They look at various different side effects on glucosamines, and it was done in Portugal. And then when they look at that, they say that long-term use of not just a short-term, but even long-term use, they mean 6 months or a year of that actually does not have no bearing on the glucose metabolisms in the body. And it also doesn't affect your blood pressure, doesn't affect other parameters as well. So in the long term, even you have heart problems, you are diabetics, taking this actually is pretty safe. A lot of my members of my family, a lot of my friends, I mean, they have taken this for years and years and years. And their data show that up to years or so, there's no long-term side effects. So I think it's pretty safe for you to take this.
Thank you, Doctor, for addressing that, because I'm pretty sure there are a lot of people out there who maybe have high blood pressure, diabetes, and when they are diagnosed with osteoarthritis, the first thing that comes to their mind is like, oh no, I have to take another pill into my body, and will it affect my other diseases? Okay, to our audiences, now that we have learned the basics of glucosamine and osteoarthritis, it's time for the giveaway question. So the question is, what is the recommended dose for taking Vitril S? Comment your answer in the chat box, and 3 lucky people from the audience will be selected to win a bone mass density test voucher worth 150 ringgit each. So shoot away your answer. All right, Doctor, let's continue from where we left off just now. Other than glucosamine, there are lots of supplement combinations in the market. Is it beneficial for osteoarthritis too?
As I say, I mean, the overwhelming evidence that we have is very specific for glucosamine, especially the crystalline glucosamine sulfate. Unfortunately, although there are some studies showing other benefits of other supplements, but the evidence is not as solid as the crystalline glucosamine sulfate. So in my clinical practice, I always tell patients that there are many available in the market. Obviously, there are some studies showing the benefit of that, but the evidence is relatively weak compared to this. So that you can take some of the other supplement if you want to, but really, I mean, don't replace. You can take glucosamine, crystalline glucosamine sulfate, and in addition to that, you want to take other added supplement. It's up to you, but don't always replace it, because some people will say that I've taken this for many years, it doesn't seem to work, and therefore I change it to another one. You see, what people sometimes people don't get the wrong impression actually is that they use pain as a guide of how effective it is, right? So for example, if I have a knee pain, I take a painkiller, it works. So to me, that painkiller is good. So if I take glucosamine, right, first of all, it takes a few weeks, right, to work. But sometimes I feel that, well, but I still have some pain, right? So what is the point of taking that? Now, if you look at the pathology of osteoarthritis, it's the disease progression. That means that over time, you'll get worse and worse, right? Once you started with OA, given some people a few weeks, some people a few years, some people might be only a few months. I've seen the shortest 6 months go from stage 2 to stage 4 in 6 months. So the disease gets worse and worse. Now, part of the reason of taking glucosamine is not just to improve the pain, and sometimes it might not be, but what it does actually, it maintains your knee in good condition. So it's like, Miss Fatin, right? So if I can create some supplement, tell you that, Miss Fatin, you are 18 years old this year. If I let you take this pill, and for the next 10 years of your life, you're going to look like 18 years old every single year for the next 18 years, because you maintain your year, right? That is good. Although it doesn't get rid of the pain completely, but it still maintains the joint. So one of the functions of the glucosamine is not just to relieve the symptom, but it also maintains your knee joint so it doesn't progress. So that's why the study has shown that, some of the studies show that by taking glucosamine, let me see whether I can find the slide. I think one of the slides, it showed that, yeah, this is the one. If you take the glucosamine, right, you actually can, your pain and the function might not improve a lot, but instead of having a knee replacement in the next 5 years, actually you delay it to maybe next 10 years or 15 years. So it maintains the joint in the optimal function. And that's one of the key advantages of the glucosamine, which a lot of people, they don't quite understand. They say that, well, I'm taking this, I still have pain, I'm taking for many years. Why do I carry on? Well, you carry on because it can maintain your knee as it. In fact, the fact that your knee is still the same after 5 years, it just shows how effective the glucosamine has been.
All right. So that means it's totally fine to take glucosamine for the long run, right, doctor?
That's right. That's right.
Okay. All right, doctor. Thank you so much for that very holistic exposure to osteoarthritis and glucosamine. Now it's time for our Q&A session, and we already have so many questions pending for you, doctor. All right. The first question is from BH. Does glucosamine prevent osteoarthritis from progressing from stage 1 to the later stage?
Okay. I think there's no study really show that how does it actually prevent it, but it does slow down the progressions. So we have seen study again slow down. If you have two group of people, one take glucosamine and one doesn't take glucosamine, and we found that the one that who take the glucosamines require knee replacement at the later stage, right? So it delay the need for knee replacement for the surgery, and that is definitely evident from the study. Now, we haven't come across studies say that it will prevent from getting worse. I mean, getting worse, I mean, we will have it. It's going to slow down very efficient. And in some study, even show that it stopped the progressions of that. So, but this study is not, there aren't that many studies as well, but it definitely delay. If you think about at the end, like the stage 4 is the need of total knee replacement. It is a surgery to replace the knee. And by taking glucosamine, you'll definitely postpone the need for that by a few years or even longer than that.
Okay. Next question, doctor. Is getting injection suffice or we need to have a knee replacement?
It all depends on what stage the knees are. Like we know, there are different. There are 4 stages of osteoarthritis. So when it comes to the final stages, which is the stage 4 or the grade 4, when the bone is on each other, when the bone is bone on bone, when the knee is deformed, when there's a lot of bone spur, then really we really need to change the tire of that knee. So that is a final stage. But luckily, from before stage 4, stage 1, 2, and 3, there are other things. I mean, obviously, we talk a lot about glucosamine because there's a lot of misunderstanding about that. It's a very important topic. But there are a lot of other treatments as well that we have not been able to have time to talk about it. Maybe next time, Ms. Fatih, we can have another sessions. We talk about injections or other type of treatments, right? Or even exercise, what kind of exercise, diet, weight loss. All these things have bearing on the osteoarthritis. Osteoarthritis treatment is not like you take the glucosamine alone. Like you say, it's a holistic, it's a multidisciplines. There are many other aspects we have to do, including modify our lifestyle, change our body weight as well. So injection itself, and the injection itself is also a big topic. There's an injection with, for example, hyaluronic acid or stem cells, which is very popular, or the PRP, platelet-rich plasma, or even injection with a steroid. So there are many different things that you can inject inside the knee, and that is another big topic as well. Another my favorite topic.
Okay, thank you, Doctor, for addressing that question. I think one of the important points that we should also highlight is that it's also important for osteoarthritis to be detected in the earliest stage. So that's why it's important for everyone to straight away go to the doctor if you do experience all these kinds and symptoms of knee pain. Right, Doctor?
Absolutely right. You see, we used to think that osteoarthritis is the elderly people. So we say that, when you're 65 years of age to have osteoarthritis is expected. But recently, not recently, in a few years ago, we already realized that the average age of onset of osteoarthritis is 47. Right? So it's actually a lot younger than we think. So you're absolutely right, Ms. Fatin. If you can pick up osteoarthritis earlier, and then you can start early treatments, and a lot of early treatment is is non-interventional. It doesn't involve surgery, doesn't involve taking drugs. In fact, just change your lifestyle, a bit of simple knowledge like control your body, and you can actually reduce or slow down the progression of osteoarthritis by yourself a lot of years, and very effectively if you can manage to detect it very early on.
That's good to know, Doctor. All right, Doctor. Another question from Choi Ying Sam. Do we need to consume glucosamine for long term or just a certain period?
Okay. Normally, like I said previously, I think the important message here, apart from the fact that glucosamine is very useful for treating osteoarthritis, we also have to realize that obviously not everybody will respond to osteoarthritis. To assume that just by taking glucosamines, all the osteoarthritis will be cured or be able to slow down the progression is also a bit unrealistic. So there are certain group of people are more susceptible. There are certain group of people that doesn't respond that well. So then you can go for other treatment. After all, osteoarthritis is a more complex topic. But for people who respond, so the first thing you have to decide actually, if I take it after I take it for 3 months or 6 months, do I feel better? Now, if you do feel better, then you have a few ways of continue. So most of the time, I will advise people just to continue with the glucosamines. But for some people have a bit of reservation, then you can do 3 to 6 months and then stop for 3 to 6 months and then take another 3 to 6 months. So you can have a break in between. Or the other way that some doctor will advise patients that after you take 3 to 6 months, you stop. Whenever the knee become painful, you take again. Now, sometimes I don't quite like the approach because when if you stop for 3 to 6 months and the knee become painful again, by which time it might have progressed from stage 2 or stage 2, stage 4, then by which time it's probably a bit too late. So I think that for people who respond to glucosamines, long-term usage, especially based on the evidence we know, is pretty safe. So I think that you can either opt for long-term usage or every 3 to 6 months, have a break for 3 to 6 months and then take again every 3 to 6 months.
Okay, so the important part is once you start on glucosamine and before you decide to stop, I think it's also best to discuss with your own doctor and see what the doctor says, as your own doctor will know your condition best. Okay, Doctor, next question from Ko. Comparing oral glucosamine capsule and glucosamine cream or gel, do they have the same efficacy?
Okay, I need to answer this question a bit more politely. And I think glucosamines, based on the evidence we know, right, is taking orally. Any other form, injections or cream, all these things, there's not very strong evidence to show that it actually really works. So for me, you have to take orally. And just like some people say that, instead of taking glucosamine, can I take chicken feet? Can I take some kind of bone, some kind of cartilage from the animals? Does it really work? It's not like that. So it doesn't quite work like that. So it's the same thing. So far the evidence suggests that the only way that glucosamines work is by absorbing orally. So it's by taking oral and not through injections or not through a cream or something that expect that it will penetrate to the skin and get into the joint and be absorbed. It is a bit is not evidence-based at the moment.
Okay, thank you, doctor. Another question, which I'm sure a lot of people can relate to. When walking up the stairs, I can hear clicking sound of my knee. Is this a symptom of osteoarthritis?
Okay, depends on the age you are, and depends on does the noise come with pain. If you have a painful knee with a noise, then you should contact my PA and make an appointment to see me. But if it's just, let's say, young people, sometimes they have a bit of noise when they, going up and downstairs, when they squat, all these things, most of the noise actually can be quite benign, especially when you are younger than 30, 40 years old. I think most of this noise is quite benign. But when you get older, especially when the noise is worse and it has a bit of pain associated with it, or a bit some discomfort, especially going up and downstairs, getting up from squatting positions, then could be an early sign of osteoarthritis.
Right, doctor. I think that's one of a good point to point out, because when there's pain or discomfort, it's already an indication that we should go and see the doctor and not just let it be and get worse over time. Okay, another question from Selina Liu. Apart from glucosamine consumption, is there any other alternative ways to prevent osteoarthritis?
To prevent, probably not. Is one of the process that very closely linked to age. Just like as much as I don't like, my hair, I'm losing my hair, or my hair is losing me, right? So losing hair and having wrinkles and all this is part of us. So as I say to you, no matter how good the car is, how you maintain, sooner or later the tire will become botak. So this wear and tear is something that we can't really prevent. However, as we mentioned over time just now, is that we can slow down the progressions. So there are other ways to slow down progression. For example, just simply a few points. For example, just control your body weight. Okay, if you can reduce your body weight by about 5% over 6 months, if for patients who have OA, study have shown that by just reduce 5% over 6 months, you actually can reduce the pain by 30 to 40%. And it's much better taking painkiller. And then other things that you can improve, can slow down the progressions or delay the onset of osteoarthritis is by looking after your body. For example, eat well, do regular exercise, build up the muscles. All right. Whenever you have injury, you must seek treatment. One of the things that we always forget actually is that we always sprain our knee or injured certain part of the body, but our body repair themselves, and then therefore we just ignore it. But what we didn't realize actually the body doesn't repair it very, very well, and you still need a medical treatment in order to optimize the. So a lot of people, whenever they have injury in the past, and after a few years, then it becomes osteoarthritis. So this is the important things that we have to bear that in mind. So to prevent it from happening, probably not, but to slow it down or delay the onset, yes, there are a lot of ways we can do that.
Thank you, doctor, for bringing up the point where we need to control our body weight, because actually by reducing our body weight, if you're overweight, can actually reduce a lot of other health risks, including hyperpressure, cholesterol, diabetes, and as well as osteoarthritis. Okay, doctor. Is the vitreal sachet type higher efficacy than the capsule type?
I would say both about the same. Some people prefer to take sachet. Some people prefer that capsule because of convenience. I mean, both are in terms of pharmacokinetics, they are almost equivalent to each other. So I don't have a preference. It just depends on which one is more convenience or the patient's preference. Okay.
All right, doctor. Even in the pharmacy, right, there are different formulations of the glucosamine supplements. So there are crystalline glucosamine sulfate on its own, and there are also supplements which contain glucosamine plus chondroitin and MSM. So which one is actually better?
Yeah, so if you look at the study that is available, again, there are very few studies compare head to head. But if you remember the first slide that I showed you, actually, glucosamine, actually, it will get into the pathway, become a chondroitin sulfate before become a glycosaminoglycan, which is the building block for the cartilage. So actually, you don't really have to consume extra chondroitin sulfate to make it more effective. However, for people, for some reason, if they don't absorb glucosamine very well, so let's say you take glucosamine after a while, you just find that your disease is still getting worse, then you can consider to switch it to chondroitin sulfate or to add chondroitin sulfate into the glucosamine. Otherwise, glucosamine sulfate itself is already sufficient to do the job rather than adding more stuff in it.
Okay, thank you, doctor, for addressing that question. We have a question from Tracy. What age do you recommend to take glucosamine?
Okay, so far as I know, there's only one study that look at preventions of osteoarthritis. Okay, and as far as I know, until so far, there's no other paper to suggest that osteoarthritis can be prevented by taking glucosamine. And because of that, the answer to the question is that when you have osteoarthritis, you should start taking glucosamine. So there's no age limit because it depends on what age you have osteoarthritis. So otherwise, I would be the first one who jump and taking glucosamine now, right, to prevent myself from getting osteoarthritis. But there's no age limit as such. It more depends on when you have glucosamine clinically and radiologically on the X-ray, they show that you have glucosamine. That's when you have to start thinking about taking glucosamine as your first line of treatment.
Okay. Another question from Miss Selina Liu. Does doctor conclude that intake of glucosamine is compatible with everyone and there is no exception to that rule?
Sorry, can you repeat the questions?
Okay, the question said, does doctor conclude that intake of glucosamine is compatible with everyone and there is no exception to that rule? Meaning, she's asking whether you are saying glucosamine is suitable for everyone and nobody is excluded.
Yeah, no, I don't think so. I mean, you cannot apply that to everyone. Our body is different, and the absorption of glucosamines is still through our gastrointestinal system. So the absorption does affect the absorptions and even the body response as well. That's one thing amazing about human actually. Until now, we don't really know. You give the same thing for 1,000 people. There are some people respond, some people don't respond to it. So that's why if everybody is the same, then then we'll just put everyone. But it is now there's a lot of the guidelines. In fact, we just look at some of the guidelines in the world. We just publish. We as in a group of doctors who are involved in different type of management of osteoarthritis, we just published a paper. Recommend that glucosamine, the crystalline glucosamine sulfate, as a first line of treatment for people with OA. It doesn't mean that it will work for everybody, but it's the first line that we should think about. If it doesn't work, then we go to the secondary treatment, the tertiary treatments as such. So it's something that we think that you should give it to everybody, and people who respond quite well to carry on taking it. But people who do not respond that well, then we look at other type of treatment. So the short answer to the question, no, it's not something that applies to all, but majority of the public should respond quite well to crystalline glucosamine sulfate.
Okay, doctor. We have another question. Does it mean that taking glucosamine cannot solve our osteoarthritis? It only delay knee replacement eventually.
Based on the study that we have, the short answer is yes. I don't think that osteoarthritis can be cured. I mean, if anybody tell you that even if you inject stem cells and all these things, I think at the moment, based on what we know, based on the evidence we have, no, I don't think it can be cured. But taking glucosamine has a lot of advantages, and not only the slow down the disease progression, it also gives people in terms of pain management, in terms of physical functions, and then allow us to have a better quality of life, right? So I think that is how we should look at the whole advantages of taking glucosamines.
Okay, you're right, doctor. Actually, even by delaying knee replacement, it actually improves our quality of life to a great extent. Okay, we have a question from Lee Cheng. I don't have osteoarthritis, but can I take glucosamine?
As I said before, I said one study which look at women with obesity, and there's a bit of advantages by taking glucosamines, but other studies have not reflect the same thing. So I would think that if you are confident that you definitely don't have osteoarthritis, sometimes you might not have osteoarthritis, but clinically, but if you do an X-ray, as I say, one of the earliest paper, 23% of the people who doesn't have a knee pain actually have osteoarthritis on the X-ray. So if you are very confident that you have no osteoarthritis, either clinically or by the X-ray, then taking glucosamine sulfate, the crystalline glucosamine probably have no advantages over other. But except one paper, it do suggest that if you are obese, you are a woman, and you are slightly elderly, then you might want to take glucosamine as a prevention.
Okay, interesting. All right, doctor. One question from Joy Wong. Will wearing kneecap be helpful for our joint?
Okay, right. Okay. The best knee guard in the world is only given to you by your mother or by God, which is, you know what it is? It's your muscle. The thigh muscle is the best knee guard in the world. Now, for osteoarthritis, we're looking at purely for osteoarthritis. Knee guard actually doesn't have much benefit except two. First, it reminds you have osteoarthritis. So when you wear knee guard, right, and then you're a bit more careful with your knee, or other people say, oh, hang on, your knee is not very good, you should. So people remind you, or you remind yourself. So by reminding yourself, you are less likely to engage in the activities that is going to harm your knee more. So that's one of the first advantages of having a knee guard. And this is not said by me, this is actually published. You can tell that everything that I say is based on evidence. And another advantages of using knee guard is that it does reduce swelling. So one of the things that you get with osteoarthritis is the knee will swell. And the more swelling it is, the more painful it is. So by reduce the swelling, so if you have to stand for a long period of time, so if you are a salesperson, you have to stand 6 or 8 hours, by the end of the day, your knee will swell if you have osteoarthritis. But wearing a knee guard, it will compress your swelling. So by reduce the swelling, the pain get better. So in that sense, yes, it has advantage, but in terms of slow down the progression of the disease or make your OA better or osteoarthritis better, no, the knee guard doesn't do that. And the best knee guard that you should wear or you should train is your knee muscle. By strengthening your muscle, it actually protect your knee more. It actually reduce the loading of the body. As I said before, remember, the heavier you are, the more you can load on your knee. So by strengthening the muscle, your thigh muscle, it actually reduces the loading onto your knee. And that is the best knee guard in the world. And it's free.
That's right. It's free. So exercise is important, which leads to our next question. If we have osteoarthritis, can we use treadmill to exercise?
Yeah. So when you have osteoarthritis, you should avoid high impact activity. So on one hand, you want to strengthen your muscle, right? But on the other hand, you don't want to overload your knee. So that is a dilemma, just like a car, right? The tire is a bit bought up, as I said. If you drive the car too much, the tire become bought up more. But if you don't drive the car, the engine will mati as well. So then you have a dilemma, what you should do, right? So then we have to choose what is activity is going to, or exercise going to damage the knee more, and which one doesn't damage the knees that much, but meanwhile can strengthen the muscle. So the thing that you should avoid when you have osteoarthritis is running. All right, jogging. During the COVID time, the only exercise that people are allowed to do to go and run, right? And suddenly I see lots of people after they run for 1 or 2 months, because these people, they stay at home for the whole 1 year, they put on weight, they feel guilty about it, so the weight become more, and then they never run in their life. Suddenly they're allowed to go out and do, the only exercise they can do is run, so they go and run. And that is the worst thing to happen, right? You put on weight, your muscles are not strong, and then you run, you pound your knee, right? You keep on running and you pound. And after a while, the knee wear and tear faster. So high impact activities like running, including jogging, is bad if you have OA. Jumping is not good. Squatting, okay? The lower you go, full squatting is bad for your knee. Even climbing stairs, climbing hill, I think with slope, also put a lot of stress. I mean, these are activities not as bad for your knee, but when you have OA, it does wear and tear the knee more. So these are things that you should avoid doing. So what are the things that are good for your knee? So you want to strengthen the muscle. So what you want to do, actually, you can go to the gym and selectively do some exercise, strengthen the muscle. You can think about cycling. The best, obviously, is swimming. Why swimming is good? Because swimming will reduce the loading onto your knee, right? Because the water will reduce the stress they put on the knee. And meanwhile, the water itself has resistance as well. And you find that even you walk in the pool, will strengthen the muscle much more effective when you walk just on the road. So if you cannot swim, just go to the pool and just walk in the pool, right? So that will reduce the loading and meanwhile strengthen the muscle. So hydrotherapy, which is a water, is probably the best thing. Now, I just see a very quick flash here, how about yoga? Now, it's a bit controversial. Yoga generally do strengthen the muscle and make you more flexible. Generally, it's a good, but certain posture of yoga, it does involve, bending the knee to the extreme. And for people with OA, certain positions of the yoga might not be that ideal for them and might actually make the pain get worse. So if you do yoga or Pilates, which is good, but you have to be a bit more specific. Certain posture, certain part of the exercise, you might want to skip and not involve fully on that.
Thank you so much, Doctor, for all the useful tips to our audience. I think that it should conclude our session today, since you have also addressed many of the questions, even though we are not able to address each and every question. At least we have addressed most of it. And before we wrap up today's session, Doctor, do you have any last words or advice to our audience?
I think osteoarthritis, unfortunately, is going to affect all of us, whether we like it or not. And I think glucosamine is important, and the knowledge about this, because not all the glucosamine are the same. So we have to know which one is working and which one is not. Otherwise, we're going to spend a lot of time and effort. But apart from glucosamine, like you say, we also have to think about other aspects, which is important. And after all, looking after ourselves is not by just taking a supplement, but in other part, for example, control your body weight, regular exercise, live a healthy lifestyles, and to think positive as well. I have patients sometimes when they first told that they got glucosamine, they say, oh God, I cannot walk anymore. They become very miserable, they become depressed. Actually, it's not as bad as that. As I said to you, millions and millions of people have these problems, but having a positive attitude, engage in more healthy lifestyle, actually can lead to very good quality of life. And worst case, if it does get worse, we can always give you a new tire. We always can give you a new knee. And the new knee lasts 20, 25 years. Nowadays, with robot doing the knee, you can do even, I got patients go skiing, play tennis, traveling around. I got this grandmother, 86 years old, after I replaced both knee, travel to US, first time in her life, and to see her grandchildren, right? So you actually can still lead a very good life. So obviously, we try our best to lead a good life, but don't be, too much of saddened by this thing, and it's not like other diseases. There's still hope for us. Be positive.
Thank you so much, Doctor, for the positivity. I think we all need that positivity midweek, right? It's Wednesday night, and everyone is just trying to get through the week. All right, thank you so much, Doctor, and everyone who has joined this webinar today. And Doctor, for sharing your extensive knowledge on osteoarthritis and crystalline glucosamine sulfate with all of us today. And also, congratulations to the caring members who have stayed with us throughout the webinar for getting 500 caring points. The points will be credited to your Caring mobile app in 2 to 3 weeks' time. If you missed the earlier part of this webinar, do not worry, as this session will be available on our Caring Pharmacy Facebook page. While you're at it, don't forget to like the Caring Pharmacy and Vitrace Facebook page. Bye, everyone. Bye, Doctor.
Bye. Take care.
You too.
Bye.